as additional resources. So what is coronavirus? I'm sure you all know this, but coronaviruses are a large family of viruses. We've seen strains of this family with MERS as well as SARS. With this specific strain, it's the first time that we see it, and it's, hence the novel coronavirus. And we know that it originally was transmitted from animals to people. Since then, we learned that the virus spreads mainly from person to person, so between people in close contact with one another, through inhaled droplets, as well as touching your face after touching infected surfaces. We know that the symptoms so far associated with COVID-19 are having a fever of 100.4 degrees Fahrenheit, having a cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, no loss of taste or smell. We know that an individual that tests positive can have all of these symptoms, be asymptomatic, or have some of these symptoms. And again, these are all things that I'm sure you've all heard of, and it's evolving as we're seeing the cases. So prevention. And for prevention, a lot of the things we do already, but with the virus spreading so rapidly, they've become extra important for us to follow. So the first one is washing your hands as often as possible with soap and water for at least 20 seconds, making sure that our hands, we're cleaning in between our fingers, underneath our nails, and in situations where we don't have the ability to wash our hands immediately, utilizing hand sanitizer that contains at least 60% of alcohol. We also recommend, avoiding touching your eyes or nose or your mouth with unwashed hands. Avoiding close contact with individuals, especially those that we know that are sick. Practicing social distancing with at least 6 feet between one individual to the other. Making sure that we stay at home if you have respiratory symptoms or have a fever or any of the COVID-19 symptoms that we now know of. Easier said than done, but also avoiding shaking hands, hugging, or other intimate greetings so that we avoid the spread of transmission. Making sure that we don't share our dishes, drinking glasses, cups, eating utensils, towels, or bedding. Making sure that we wash them thoroughly after each use with soap and water, putting them in the dishwasher or the washer. Avoiding or limiting contact with pets and animals. Although there hasn't been a lot of research or a lot of cases, we have seen situations where a person who's infected with the virus has passed the virus to their dog or their cat. So we just recommend overall that we avoid or limit our contact with our pets if we aren't feeling well. So making sure that we cover our mouth and nose when we cough with the tissue, and making sure that when we are sneezing, rather than sneezing on our hands, that we sneeze inside of our elbow. Making sure that we throw away our used tissues to the trash. And again, immediately washing our hands with soap and water for at least 20 seconds after we've been sneezing. So cleaning and disinfecting frequently high-touch surfaces, whether it's our cell phone, control remote, keys, door handles, whatever we touch often, making sure that we're disinfecting it, making sure that we clean our dirty surfaces with soap and water, making sure that we use gloves when picking up used tissues or emptying waste baskets, as well as making sure that we're cleaning our linens, eating utensils, and dishes. They don't have to be cleaned separately, but making sure that you're not sharing them with people without washing them. So reducing the spread. As you all know, in the state of California, face coverings are required in all public spaces. That is something that Governor Newsom mandated, and in San Joaquin County, we are implementing. So recommendations when wearing a face covering that we give people is to make sure that they're washing their hands before and after they put on a face covering. Making sure that the face covering that you wear, whether it's a reusable face cloth or a disposable one, that it covers your nose, mouth, and chin. Wearing a face covering without it covering your nose defeats the purpose. Having your face mask hanging from an ear or underneath your chin to talk to other people also defeats the purpose. So when we're wearing a face covering, we have to make sure that it's covering, again, our nose, our mouth, and our chin. If you are going to be eating or drinking, taking it off rather than hanging it from an ear, making sure that we wash the reusable face cloth mask at the end of the day. If we're wearing a disposable one, throwing it away after each use, if not at the end of the day. For reusable face mask, we recommend that individuals wash it in hot water and air dry it or dry it in a hot water cycle. So those are some of the precautions and tips that we're telling people to do when they're in public, especially in places where social distancing is difficult to maintain. So postponing all social gatherings. I know this one's probably the hardest one for all of us, especially with the nice weather. But if you don't live in the same household, we are recommending that you guys don't gather. So the blueprint for reducing COVID-19 in the state of California has 4 categories. The categories are based on test positivity, so the number of positive cases that we have for the county, as well as the overall case rate. So we have the 4 colors, purple being the highest or the widespread of the virus, and yellow being the lowest. So on here, you kind of see a little bit of the breakdown that for widespread, we have more than 7 daily new cases per 100,000, and more than 8% of those cases are positive. So San Joaquin County is in the widespread tier 1 category. We're in the purple. We have the most restrictions because of how rapidly COVID-19 is spreading throughout our county. So in order for us to move from purple to red, which is a substantial category, we have to meet the metrics for the new COVID-19 positive cases per day per 100,000, as well as meet the criteria for positivity and overall reduce the number of cases that we're getting. So we do have a stay-at-home order that we are enforcing, and with that stay-at-home order, certain activities are permitted versus others are not. So as of today, we currently have a total of 19,841 cases. We have a total of 415 total deaths, 163 total outbreaks. So of the total cases that we have, 59.5% of the cases are in ages 18 to 49, and 57.1% of the outbreaks that we have are taking place in the community. So this data is updated on a daily basis on our sjcphs.org website, which you have an image of on the right side with the dashboard. It's interactive and you can look into the breakdown of the age groups, race, ethnicity, as well as gender. So this is just kind of the blueprint continued of what the guidance we've received from the state. So on there you can see what sectors are opened versus not opened for the different tiers. So since we're in the purple tier, for example, hair salons and barber shops are allowed to be open indoors with modifications. So any of these sectors that are listed will go to the COVID-19.ca.gov website and would be looking at the guideline that the California Department of Public Health has set in place so that they can open and be able to receive customers. So again, this is just kind of what has been provided. These are subject to change depending on what our state health officer and the CDC says. As you can see, because we are in the purple tier, a lot of the activities that involve people from different households gathering are not necessarily permitted, or if they are, have restrictions. So for contact tracing, there are some principles that the contact tracers are trained on. So the first one is that the information that is being communicated between the contact tracer and that person being called is confidential. This becomes important when an individual that has been contacted is hesitant to share their information, especially if someone is undocumented. This becomes crucial because of the fear of being having their information shared with ICE and other government agencies. So the contact tracer reassures the individual that the information that's being shared is confidential, that it will not be shared with anyone else, and that they will not be penalized for sharing this information. Making sure that the conversation is client-centered, so putting the client at the center, making sure that we're making that client is feeling comfortable, that their needs are being met. The contact tracer also lets the person being called know that this is a voluntary process. Any information that is given is 100% voluntary, and it's okay if they don't want to share any or some parts of the information that are being asked. The practices for contact tracing are evidence-based. They have been used in other contact tracing for other diseases such as tuberculosis, and they follow the CDC guidance. And for this particular, we're following also what the state guidance is saying. And lastly, the conversation needs to be done in a way that is culturally and linguistically appropriate. So if the person that's being called is Spanish speaking, the individual that is calling them is also Spanish speaking, preferably someone from the same cultural background, so that we can help break down some of those barriers that can potentially arise from cultural and language challenges. So what does a contact tracer do? So the contact tracer communicates with the contacts to notify them of an exposure, provide disease and transmission information, collecting information about living arrangements and daily activities. They inquire when it comes to medical status for signs and symptoms, any underlying medical conditions that they might have, as well as provide referrals for testing. They provide protocols to maintain their health and the health of others. They follow quarantine instructions, monitor potential COVID-19 symptoms, and make referrals to other services if necessary. So a contact tracer, again, provides recommendations for quarantine or isolation to limit further exposure. So anyone that has been identified to either have a positive COVID-19 test or been exposed to someone that has tested positive will receive an isolation or a quarantine order, as well as additional instructions on what they're supposed to be doing. The contact tracer also provides resources for the housing if isolation is required due to infection. They provide referrals to other social services, such as 211 or other CBOs that are providing essential needs to the community. They follow up communication to assist for symptoms and well-being, as well as making sure that those that are being contacted are not necessarily told the identity of the person that exposed them. So again, maintaining that confidentiality of cases. So there's a lot of confusion between what isolation and quarantine is. So if someone's told to isolate, it means that they're as an individual, they tested positive, had symptoms, or received a diagnosis from a healthcare provider on COVID-19. If that individual is told to isolate, they must stay at home for at least 10 days and not have had a fever for at least 24 hours, and their other symptoms have improved. If all of those things have been met, then that person can be released from isolation. A person who is told to quarantine is an individual that has been in close contact to someone that has been confirmed as a COVID-19 positive case and has been exposed to that person for over 15 minutes with less than 6 feet of distance. If you are told to quarantine, you must stay at home for 14 days from the day that you were in contact with that confirmed positive case. So there's a lot of confusion about isolation and quarantine, and this is probably the hardest part for a lot of individuals and has created some fear when getting tested. That fear of, if I test positive, having to isolate means that I don't get to go to work. I may not be able to provide for my family. So this is one of the areas where contact tracing becomes important, and helping reassure that individual that you're not going to get reprimanded for taking these steps. So if you do test positive, you would be receiving one of these flyers from the health department or testing agency, which again kind of goes over when to self-release from isolation. So within San Joaquin County, we have this flyer where you can find all the testing information. So on the top, you see all of our health centers or clinics that offer testing. Majority of them on the top are offered for their members or patients only. On the bottom, we have Optum Serve, Project Baseline, or Verily, as well as the City of Tracy and Planned Parenthood and CVS Manteca. And these 4 locations are testing sites where people can go to receive free testing. It doesn't matter if you have health insurance or not. For some of these sites, you do have to call in advance to make an appointment, but for others, you can just go ahead and do a walk-in. We are in the process of securing a 5th location here in the city of Stockton, where individuals again can go get free testing for COVID-19. So if there's any questions regarding guidance for reopening of a business, we recommend individuals to contact our Office of Emergency Services. They have an email, which is sjreadyfeedback@sjgov.org, where they answer specific questions regarding what's open, what isn't open, and if you are going to be opening, what you should be doing. And then if you have any health-related questions or concerns, you can email the PHS-info@sjcphs.org, which goes directly to myself and my colleagues, and we try and provide answers to some of the health questions that we have. Overall, for anything related with COVID-19, you can find all of our information on our county's website, which is sjcphs.org. And that's all I have. I don't know, Erin, if you're wanting people to ask questions.
Yeah, definitely. If anyone has any questions for Jessica, please go ahead and unmute yourself and ask if anyone has questions. Jessica, what is the most common question you get from those, you mentioned that email that is open for people to ask questions. What are some of the most common questions you see from the communities?
In general, or as in the last 2 weeks? Because there's a big difference.
Oh, is there?
Yeah. So within the last 2 weeks, we've gotten a lot of, not so much questions, but a lot more of concerns from parents and teachers regarding reopening of schools and the waiver process. So we got a lot of those lately within the last 2 weeks, because our health officer has kind of reconsider, what the protocols would be. When it comes to COVID overall, I think it's mostly people wanting to know what to do if they've been exposed to a positive case. So, at work, so-and-so has COVID, should I go get tested? And then also a lot of people asking where to go report violations of, businesses that aren't following the guidelines, and businesses that shouldn't be opened that are opened.
I had a question about, sorry, you can go ahead.
No, go ahead.
Okay. My question was about it's like an individual who gets like the antibody test to prove that they have recovered from COVID. Is there contact tracing steps that are relevant for that kind of exposure? Or
As far as the testing goes, at the state, we have been encouraged to really promote the nasal swab testing, not so much the antibody testing. A lot of the antibody testing that has been done in the state has been experimental. I know that Kaiser and I believe Dignity Health were doing some of that testing here. So we've been pushing for the nasal swab because that currently is the best practice. And I do this because it's constantly evolving. And, one thing we're told, these are the guidelines, and then the next week it changes. So right now, the best practice is the nasal swab. By all means, if you want to get the antibody testing, I mean, we're not opposed to it, but as far as our case count goes and positivity rates, we're being essentially looked at for nasal swabs.
Jessica, we've utilized, sorry, Ricky.
No, go for it.
We've utilized a few of the free testing. We've done Optum, we've done some CVS, and we haven't done them for a while, but it seems like the results on those were coming back at about 10 to 14 days. Has that improved? And is there a place that might be better than others as far as getting results back?
Yeah, so originally that 8 to 14 day delay was due to reagents in the area being out of stock. So that really pushed a lot of the testing sites to send their specimen to our county lab. So our county lab is actually a regional lab. So we were also processing tests within, the neighboring counties. So that was the reason why it was such a big delay. Since then, it has improved, and the testing is back to the 3 to 5 days. I think it's important to know that when you do go get testing done, that you have in mind the possibility of having to isolate. So trying to reduce your outings, and if you do, taking the precautions, because there's a chance that you might test positive, there's a chance that you might test negative. The test is really, a point of time. It doesn't mean that, oh, I tested negative, I'm good. You could do certain activities that would potentially increase your chance of exposure and then later on test positive. So as far as testing sites go, we're still promoting all of them. I know that with the new site opening up in the Eastland Plaza here in Stockton, those tests would be processed, I believe, still within 2 to 3 days. So we are looking into how fast can we process them so that when an individual gets their test results back, it's still within that window that they can isolate and, not spread the virus.
All right, I think I got the green light to go this time. All right, Jessica, thank you for taking the time to talk about this with us. I was just wondering, so I saw the numbers, Stockton's been hit pretty hard with the COVID, and it's been one of the biggest hotspots kind of in California. And I was just wondering, what are you seeing a certain demographic that's being hit the hardest? Is there a certain ethnicity? What kind of makes up the numbers?
Yeah, so San Joaquin County, as well as the other Central Valley counties, have been hit the hardest with COVID. The group that we've seen that has the most number of cases is our Latino community, specifically among the agricultural community. They make up over 60% of the cases that we've seen test positive. However, they only make up about 40% of the county population. We are having efforts to try and provide more testing to the agricultural community. We partnered with San Joaquin General Hospital to do testing. However, we're seeing that with the agricultural community, it's not that there's resistance, but we're dealing with other barriers. So people being fearful of testing positive and, losing their job because of it. If they are in the ag, work, more than likely, they may not be legally in this country. So the fear of being deported is something that we're dealing with. We're also dealing with individuals, not having healthcare access, period. So these are all barriers, I think, that are preventing our Latino community to want to go get tested. And then there's also this idea that, I'm okay. Even if I have symptoms, I will still go to work. I'll push through it. And then we see them, get super sick and then end up getting hospitalized. So we are trying our best effort to try and, reach those pockets, but we also have to be realistic that we're dealing with other factors that go beyond, just us providing testing for them.
Do you have any updated information like about vaccinations or treatments that are coming through? Like I know there hasn't been a lot of developments that recently, but just wondering what you're hearing on the health official level.
I know that our health officer has been in communication with the state health officer. There's talk about it. We've, as part of our emergency response, we have a team that is working on the planning of mass vaccination. However, we haven't really received any full confirmation of when we're expected to start doing these. I know that there's been conversations at a national level about having a vaccine ready by the end of the year. We've also heard, that by next, January, we would be rolling something out. So it's still very much conversation. Nothing really has been officially confirmed.
Going back to the highest demographic being agricultural workers having it, should we be taking extra precaution with like cleaning our food or stuff like that?
From what I've looked at when it comes to food, I think the research hasn't necessarily shown that the virus is spread from you touching, certain vegetables or certain fruits. I would just say continue doing, your hygiene, right? When you go to the grocery stores, regardless of COVID or not, you would wash your fruits and vegetables. I think that's basically the best we can do. Obviously, if someone is testing positive within, a cherry picking facility, that agency or that business works directly with our disease control prevention group, and they implement protocols to help reduce the spread. So we haven't seen those outbreaks that we saw within the agricultural community and those type of sites have been contained. So I wouldn't necessarily feel the need to be extra paranoid about washing your things. Again, the same risk you're taking, right? So it goes from the fields to the packing to the, the distributor to the store, and then it makes it to the store employee. So it's gone through multiple hands. And I think that's where disinfecting your surfaces and making sure, when you're cooking that you're cleaning, your utensils that you're using to cut your vegetables and your fruits and your meats and all these things. So I would just say keep taking those precautions. Because at some point, we are containing those outbreaks within those areas. Any other questions?
Does anyone have any other questions for Jessica? No, I don't see anything. Okay, thank you so much, Jessica, for being here. Thank you for providing us with all of that great information. We really do appreciate it. And I will be sure to check with the smoking thing for you and email you back for that.
Awesome. Thank you all. Stay safe.
Thank you for your time.
Thank you for your time, Jessica.
Thank you.
Thank you, Jessica.
Thank you.
Thanks, Jessica.
Bye.
Bye, Jessica.
Hey everyone, don't forget that we have to do our fundraiser next Sunday, the 25th. So it's 5 to 9 p.m. at the Chipotle in the mall. And online orders and apps will work on the Chipotle app, but only if they're picked up between 5 and 9 p.m. So you can't order at like 4:30 and pick up at after 5 o'clock. That has to be made within that window. And then if everyone, I think everyone got an email with all the flyers and stuff. So be sure to like advertise and everything, send it to whoever you think might be in your area, coaches, teammates, everyone like that. And even though we are social distancing, let's try and make a good turnout, okay? Thank you.